So in this video, we're going to have a look at treating the neck. So we've started here with your client in face down or prone, with Charlotte working from the head of the couch. So she's starting off with some nice opening effleurage style techniques just to warm up the neck as you would do with any other area.
So what we can see as well is that actually you're not going to be able to put a huge amount of pressure on this area. It is fairly delicate.
It is.
So where there you might have seen I had my arms bent, that isn't a problem. I'm using my body weight, I'm lunging in, I'm moving my body, but I'm keeping that like slightly flexed elbow to enable me to put some pressure on, but not too much.
You saw some petrissage there just between the joint of the neck and the shoulder. So really when you're treating the neck, you actually do come down into the shoulder because you have to remember which muscles go where. So it is important to treat the whole area.
I really like this technique now. I know Tamsin does as well. Almost a little bit of picking up through the back of the neck. It feels really nice. It means you get both sides, left and right, and actually gives you a good idea of comparison at both sides, as well as just actually getting it moving a little bit.
And just stretching through the muscles there, opening up, is a lovely, lovely feeling from a client's point of view. And as you can see, Charlotte's really moving around the couch. She's not staying in one place, so she's picking the best place to treat from. That's also quite a nice move. Pulling up into the bottom of the occipital bone is a really nice release through there because the muscles do come up into the bottom of the skull, so don't forget that.
Yeah, that really lovely pull also gives you a nice stretch up through there, as well as just sort of a relaxing release on the back of the neck as well. It's really nice, almost sort of a half money maker, if you like, at the end of your massage on there. The other way that you can treat is from a seated position.
So this is really, if you're in a clinic, this is a good way to do it because it will help you to control the pressure you put through, but also give you better posture. The other thing we've got there is if somebody's got long hair, you can use a towel to protect their hair from the oil. So this is, it's just a rolled up towel, and you pop it at the base of the sort of the neck and pull it up, and you catch the hair there.
Yeah, keep someone's hair out the way. Top tip from us for the day. So what you can see here is a really good pressure right into the base of the neck there. So again, now at this point we've got straight arms, really relaxed through my spine posture. You can see I'm not putting any force through there. It is just a good solid pressure. Chatting away to Tamsin throughout the course of that pressure.
Generally, when I treat neck, I do it from a seated position purely because I feel I'm more in line with the muscles. I'm not sort of so much above them, but I'm working in length with them, if that makes some sort of sense.
It really is, though, something you can try yourself. Try from a seated position. Try when you're standing. It's completely personal preference. You can try with different couch heights as well to give you a different variety. Now, again, you can see I'm sort of changing around, changing up what I'm doing, and they're a really nice sort of reinforced finger. You'll also see I almost effectively stretch quite a lot through this area. Now I'll often use like my left hand there to support the traps so that as I'm putting a little bit of pressure on at the top of the neck, I'm not getting so much trap activity, the movement of the traps taking that pressure off.
The other thing is you can get up out of your chair, so you don't have to stay in the chair. You can get up and down. I do it all the time. Yeah,
just make sure you move your chair well out the way if you're doing that. You don't want to be tripping over it. So here again a slightly more sort of reinforced sort of almost the knuckle I'll be using in there to get the pressure on. Keeping sort of above the technique and the pressure direct into it is really important. So actually I've also secured sort of the left shoulder. I've got my other hand on the shoulder, just keeping again that secure pressure, keeping it stable.
So the neck is an area that you treat slowly. You can't rush it, so you do use lots of small techniques rather than big brash techniques almost. And as you can see here, Charlotte does what I do, and she stood up to treat because that's the most comfortable position to be in. Also, she's utilising down into the traps because the traps are one of the main muscles that come up into the bottom of the occipital bone there and do cause a lot of problems for people. So flushing down through them is not really a problem. It does make it part of the neck massage.
So once you've done that, treated perhaps with your client down and prone, you might choose to treat them in a supine position. So here you've got your client face up. Again, we'd be utilising double toweling. So that way you can access a little bit of the pecs if you need to. Perhaps utilise it within a whole sort of massage of the shoulder neck region. However, what you can see here is I'm supporting the head with my hand. I find that really useful because you can put the muscles in a shortened or slightly elongated position, which might give you better access. Depends on what you're trying to achieve.
So, word of warning here, when your client is in supine and you take their head, until they trust you, and even when they do trust you, they find it very difficult to let their head go. So you do need to remind them, if they're lifting it up out of your hands, that just to let the head go. It's not an area, unfortunately, you can use shaking to get them to relax the muscles. So you do have to communicate with your client well. And as Charlotte said, that you can then move their head around so much better. The other thing I'd advise not to do when they're in supine is have a pillow underneath their head, because it makes it more difficult for you to work, but also it takes their neck out of alignment a little bit. So you want to try and keep everything nice and straight.
So again, in terms of techniques that we might be looking at, Tamsin's mentioned we're not going to be using shaking. Now, we've said everything's going to be a lot smaller in this area. So I might be looking at sort of reinforced fingers, single-handed cam. As you can see, I sort of see here a broad pressure into the base of the neck. All those things are going to be really, really useful. A little bit of petrissage, but again, you're going to need to adapt it. Maybe look at using just one hand, your thumb much more on one hand along with your fingers, rather than a sort of double-handed technique is going to be a little bit invasive around the neck.
Especially when you've got hands the size of plates like mine. So the other thing that you can utilise here is the client's head weight. It's great for creating the force that you need rather than putting the strain through you. So quite often I'll come up underneath the back of the neck and pull up, and then just allow their head weight to create the pressure into my fingers, which is a really nice way of doing it as well.
Yeah, it really is. So what you can see exactly now is what Tamsin's just described. I was just starting to move into it. But also stretching. So here again, another example of a stretch. So securing the shoulder, really lovely stretch for the traps, the scalenes. And if you change the angle of the head, you'll get different muscle fibres, of course, whether you're getting anterior, posterior scalene, even a little bit of sort of your levator scapula. But then this is where you get that sort of pressure of the head, lovely pressure right into the back, up under the occipital lobe. And you can just put a really nice pressure there, perhaps move your fingers in little circles, or just let the head sit there, the weight of the head just release on a really gentle pressure.
So this movement, I kind of call it a rope pull here. It's one hand going down to the bottom of the neck and then coming up. It's a good form of effleurage just to help to flush through the area. And then you can go back in with a little bit more deep work there. So again, into sort of that pressure type movement.
Yeah. And so again, you can see that I'm moving around the chair a little bit here to make sure I'm in the best position. So whether you want to stand up or just move the chair, it is all exactly the same as if you're stood. It doesn't matter. You can move effectively your feet or your seat. Make sure you're treating from the best angle and utilising your treatment as best as possible.
So that's why it's good to have a chair with wheels on it, because you can wheel around your client quite nicely. If I'm working mobile, though, I'll quite often be down on my haunches for this bit, to be honest.
Yeah. And then again, you can see here, really nice stretch. Often finish off a treatment like that.